So my name is Anise, as you know, and I go to a school in the Bronx called Theater Arts Production Company School, and so does Kiara Walters.
Thank you, Anise. Hello, Brandon. My name is Kiara Walters, and I also go to Theater Arts Production Company School in the Bronx.
Nice.
Good evening, Brandon. My name is Ian, and I go to A. Philip Randolph High School.
Nice to see you.
Okay, so these are our mentors, John and Christine, as well.
Hello, Brandon. Thank you for coming.
Absolutely. Thank you. Christine and John, nice to meet you.
And our director,
hi.
Jessica.
We met a minute ago, yeah.
Hi, Brandon. I just wanted to introduce myself. My name is Sage. I go to the Marksy Prep in the Bronx, and I'm one of the interviewers. Yeah.
Good. Oh, nice to meet you all. Thanks, Sage.
Okay. So for our first question is, how did you get involved in the mental health field, and what led you to focus on schools and youth?
So I'll keep this relatively short because it could be a really long story. I actually went to my introduction to mental health really was kind of a little bit of an accident. I was looking at a sort of a career change in my late 20s, early 30s, and so I started doing some research. And my previous background was in music, and I was trying to look at different options of what I could do. And on the whim of a friend that remembered what a sort of a conversation I had, I said, remembering, he's like, you're really good with your memory and remembering what people say. It's like, you should either be a therapist or a lawyer. And so I didn't think law school was in the cards for me. And so at the time, I was actually living about 4 or 5 blocks south of Columbia University. And I literally went into the bookstore and I was walking around and I found this little book that was written by a therapist and his wife, who was a musician. It was about the importance of therapy. I'm like, well, this is kind of cool. And then I ended up going to Teachers College and got my master's of education there in the clinical counseling. I can't even remember what the department's called now. The counseling program. And I did the mental health counseling track. And so, from that was, when people ask me sort of like how I started, I don't know if I really knew, even in grad school, it was kind of theoretical, right? And sort of doing that. But it wasn't until after I graduated, eventually found a job working north of the city in Rockland County. I was working in a community mental health organization. And where I really became sort of committed to the work of mental health was actually seeing adults who had serious mental health issues that really had high needs as well. So whether not just around kind of their mental health needs, but also health needs, social determinants of health, kind of issues in their lives where I think a lot of times the support systems that they needed, the folks that were around them, their families, their friends, their neighbors, the community, at some level kind of failed them and wasn't able to sort of help support them. And so through my work with that organization for over 7 years, I had some opportunities working with high school students around kind of career and mental health, more career development stuff with them. And so where I landed now is really just a process of being involved kind of at different levels in my previous job, supervisory, director roles, and kind of working at our affiliate level in Rockland County. And then through an opportunity that came up this past spring, where our mental health association in New York State, so sort of our kind of like mothership, as I like to call it, of our 26 affiliates, had an opening for the director of the School Mental Health Resource and Training Center, which is a really long title, but it's kind of our work in schools, our K through 12 schools. And so I'd been knowledgeable of the organization, worked with them kind of on my own, again, at that sort of affiliate local level. And so I saw this as a really great opportunity to take, and I mentioned before my music background. So I had been a classroom music teacher and kind of taken my love and interest in sort of working with kids and students at the time, but also my current work as a mental health professional in the community setting, and then also kind of my role as a therapist in private practice. And so you're actually catching me at the end of my Monday session night, which is great. So that's my long-winded answer to how I got into it. And I think really the when I talk about why it's important, or would think why it's important for me in this particular role, is to realize that the importance that when we talk about mental health, it is not necessarily done in a negative. It's that everyone has, just like physical health, we all have mental health. And so we have an opportunity, I think, and a responsibility to make sure that we are teaching every student, at any level where we're able to talk to them at any age, kind of having to understand that their thoughts, their feelings really impact their behaviors, their actions, and that that really kind of, as I started out, those adults that really the system failed, that doesn't need to happen if we have a culture and a climate of understanding that we all experience different thoughts and emotions and feelings. And it's really important to look out for, not just sort of the big things that can cause problems, but for the small things, and that we all sort of have, day-to-day stuff that can really, with the proper support and help, can really help us sort of move through and be successful as students, as adults, as family members, as friends, so on and so forth. So I think that's kind of my long-winded answer. I don't know if I answered it properly, but.
No, yeah, you did. I like the really good point that you make, that we should take mental health into consideration, not only when negative stuff occurs, but to prevent those negative thoughts. We should look at it as a day-to-day routine and checking in with ourselves and our peers. So thank you for that. And I think Kiara has our next question.
Thank you. So for our next question, what is your favorite part about your job?
I think this is actually one of my favorite parts of my job, is that I get to talk to people and people that I don't know. And that's kind of, I actually really like that, and kind of get to know people and in a different context. And one of the things that I will say that I think is so, and I was actually just remarking about this today, is that I was like, when I was in high school, like, I don't think I was half as motivated as some people that I see now, right? Like what you all are doing is really great. And I don't mean that in sort of like, oh, some sort of old person telling you how wonderful you are and how, like, but I think there's a sense of really some excitement that I've seen and really had an opportunity over the past 6 months to see around specifically students saying, this is important for us to be not only sort of talking about what's going on in our lives, but talking about how do we change systems, how do we change inequities, how do we challenge things when they need to be challenged, and really sort of show up in a way that I think, I will say, some past generations maybe didn't either have the opportunity to do, or there weren't avenues for them to do it. So I really love being able to connect with a variety of people. I love being able to sort of have conversations with folks that sort of, whether those be school counselors, whether those be educators, teachers, administrators, and really sort of help them understand that anything that we can do to support our students' mental health, wellness, the process of sort of how they are understanding their emotions, their feelings, and their experiences is going to be beneficial. So I love the opportunity to talk with people, and because it also means that I'm not spending time on my email, which is really important, that I can stay away from my email as much as possible.
Thank you for the answer. And I would like to add another question. Why do you think mental health is important for youth?
Because we're human beings. I think, and like I said a moment ago, if you burned your finger, right, you would do something to sort of like put a Band-Aid on it, or if you had a blister, or if you broke a leg or broke a bone, or if you had any sort of physical problem, right? If you have a cold, you have anything, you want to tend to it. And I think the problem we talk about mental health is we only historically have talked about mental health in the context of deficits and disparities. And so one of the things that I think is important to do is to draw out when you do things well, when you overcome a stressful situation, or you are able to sort of manage an anxiety, or you have just a really kind of awesome day, right? I was going to say something else, but like you have a really great day. Like that's good to sort of actually acknowledge and talk about what made this good, what made me feel good about what I was doing today, what made me feel proud, right? What made me feel like a sense of accomplishment. And I think it's important when we talk about mental health is that for so long in our culture, in our sort of, if we think about the history of mental health and mental illness, to use that term in the United States, is a really dark history. And so we're not that far away from hospitalizations and asylums and sort of the idea that people with mental illness were a threat and danger to themselves and to others. And so what we have is an opportunity to say, why is talking about the way we feel any less appropriate than talking about sort of what we like to listen to, our favorite sports team, our favorite TikTok artist, whatever that thing is? Why is it any different? Why is it something that we shouldn't talk about? And I think part of it is that, you know, what goes on between the ears, or over here, right, between the ears, is just as important as what's going on in the rest of our body. So, and that nothing we feel, this is kind of the therapist part of me, nothing that we feel is good or bad. Whatever we're feeling is telling us something about who we are. It's telling us something about what we need, what we're missing, what we value. And so we have to kind of really kind of step away from this idea that somehow mental health is this thing that just is kind of off on the background, when, like I said at the very beginning, I really view it as part of a whole integrated approach to sort of how we as human beings live and function.
Okay, I'm gonna ask the next question. Thank you for your input, by the way. So how can we as students improve community mental health?
Oh my, that's a big question. It's a good question. I think what you're doing right now is super important, and I don't mean to say that kind of in a pandering way. I think it's really important to find places where you can make your voice and your needs heard, and whether that's at a school, through this particular project, through you know, your organizations. Where do you like hang out? What is it a religious organization? Is it a sports group? Is it is it part of a music ensemble? Like, where can you sort of like kind of connect the dots in some ways? And I think in terms of improving community mental health, I mean, that's a big question, because what is defined community, right? What is the community? Well, who are you around? Who's in your household? I guarantee you that some adults in your lives are struggling in their own way. And so how do you kind of take a risk to sort of show vulnerability and talk about what's going on with you, and, encourage people where they need to be encouraged? I also think it's really important. Like, I will say that it's important to be active in terms of, I think, voting, and sort of being, and if you're not at a voting age, then it's sort of making your sort of wishes known and kind of writing and sort of being active in that way. I think it's all about relationship building is important. So when we think about communities, I think about who's the one person you can talk to, who are the two people that you can talk to, that you think, try this differently. And I think part of it is if you see something, have an idea about something, have an experience, share it, right? And if that person's not listening to you, go to somebody else. And finding the person that is receptive, because there are receptive people out there. It's a challenge. And so I think the bigger step is to kind of also think, well, what would that look like? What would better community mental health look like? What would that be? Would that be more access to services? Would that be less? Would that be more practitioners who speak my language and look like me and come from my community? Then that becomes sort of how are we supporting people in sort of that? Are we saying are certain fields only for certain people? I think it's a big complex issue, but I think how do you start and find that one or two people that you can start with in those conversations is what I would say to that really, really big question.
Thank you. I'll be sure to take that into consideration when I'm going home and going to school and dealing with different people and their perspectives and their personalities. I mean, because like you said, like some people are what's the word? Some people are, I guess, is receptive to what you have to say, and some people are not. Thank you.
Absolutely.
Moving on to the next question. What resources does Healthy Minds for a Healthy New York offer, and what problem is this meant to address?
So that Healthy Young Minds for Healthy New York is kind of our little tagline. So the organization, we refer to it as Mahaney's, which is kind of the acronym spelled out, right? So Mental Health Association. We provide a lot of resources, like I mentioned, to our affiliates. So we have 26 community mental health organizations across New York State. So we provide a lot of advocacy work. So for example, next week, we are doing some online panels for around school community mental health partnerships, teaching people about 988, which is going to be the new sort of the suicide helpline, like 911. It's rolling out in July. We're talking about workforce development around mental health needs, but it's all in the context, like, for example, of legislative. So it's our legislative days. So it's our advocacy days for the Capitol. So we try to encourage people to sort of learn how to be legislative advocates, how to speak to their representatives. And so that's one particular thing that's happening next week. And I'd be happy to share afterwards the link to that. If you want to share that out, people can get involved. If we're doing a virtual rally, which is a little different than actually walking around the Capitol and doing all that stuff. But that's one action to say, here's how you write a letter to your state senator. Here's how you write a letter to your representative. Here's how you ask for something that you might need or want. We also provide, with my particular role, we provide a lot of resources to teachers, educators around the mental health education law. So helping them understand curriculum development resources, understand social emotional learning resources and frameworks, helping them sort of strategize around the best ways to talk about, to teach, and to model good mental health habits in schools, do a lot of professional development. We really don't work a lot with students because that's not our role, but we try to support organizations, schools, community organizations that do work with students and families and caregivers. So we provide a monthly webinar series that's geared towards helping families and caregivers understand the variety of mental health challenges or mental health considerations for K through 12 age students. We've done stuff around the intersection of mental health and special education. We're doing we're doing a webinar next month on kind of healthy habits around social media, geared towards sort of talking at that very sort of level and impacts that can have on the mood, the risks about kind of self-harm or suicidal thoughts, and also just kind of their general mental health. So those are some of the those are some of the projects and things that we offer that are specifically related to kind of the school, teen, population, and also, providing a lot of training for teachers, for community members as well. So again, that's that. I hope that answers your question about what we offer. But we try to get people sort of, if we can't offer something that's more directly related to sort of like concrete needs and services, then we have what we call our mental health information center. We provide people contacts and local resources that they can get. And we try to always connect them to somebody in their own community that is able to sort of provide what they might be looking for.
Yeah, that totally answers the question. Sorry, Kiara.
It's okay. I actually have a follow-up question on top of that question. Do you guys provide any resources for like teenagers specifically?
We have some resources. There's a section on our website that is geared towards students, and that's the framework of my project, is really students. But we also have, we have things that, not everything that we've ever provided was obviously put online. So we do have lots of things that are, that are around kind of. So for example, we have a section of our website, an A to Z section. I'll highlight that, for example. It talks about all sorts of different things: bullying, anxiety, depression. Maybe I'm just picking stuff off the top of my head right now, and it really is, what's considered, what to look for, when should I worry about certain things, and where should I get help, right? So we also have links to our national organization, Mental Health America, that has a lot of resources that would be more specific towards, say, a teenage audience. But I think, information is information, right? So I would say that one of the biggest things that we would offer is our sort of our A to Zs. It really kind of helps explain various aspects of mental health, lets people know like what's to be expected, what should you maybe be a little bit more concerned about if you're experiencing this, how to help somebody, how to help yourself, and then also where to go when you're really finding that you're not able to sort of take care of yourself when you need to.
Thank you.
You're welcome.
Okay, next question. Where's the first? Okay, we were looking at a bill called S 1969 in the New York State Senate that would require schools to employ mental health professionals. Did you get that?
Did I get that?
Yeah, like, did you hear what I was saying?
I did hear what you're saying. Yes,
Okay.
Yeah, okay.
Okay, so my question is, do you have any thoughts on this bill's impact?
So I don't know specifically the content of the bill, so I can't speak to that. But if I'm correct me if I'm wrong, what the bill is basically saying is kind of requiring a certain number of mental health professionals in schools. Okay, so great, that's wonderful. But why do we teach people first aid? Why do we teach people how to sort of take care of other people, right? So if we rely only on the mental health professionals, the social workers, the psychiatrists, the psychologists, to do the work of of being aware and responding to students who either have serious mental health issues or even just sort of day-to-day stuff, we basically said, hey, I can't do this. That's their problem. Now, I think that both things can be helpful. I think there should be a certain number, or I think we should have kind of schools, the access to resources and care that you get in school should not be determined by your zip code. If you go to school in one location, why should I have benefits and sort of supports and access to resources that a student maybe in Buffalo doesn't get, right? That's not equitable. But the second thing I would say is that I think we have to do a better job at teaching the entire school community about what it is to be mentally well, to have to understand the impact of mental health on a spectrum from well to unwell. We have to teach teachers, support staff, administrators, those sort of people who are, every adult in the school needs to understand, what can I do to help somebody who might be struggling in this moment? And if I can't help them, where do they need to go? And then the last thing I'll say is that we also need to be doing a better job at teaching specifically in high schools, we need to be a better job at teaching our students how to be aware of and how to support their own friends, colleagues, their peers. So I think it's a multi thing. I think you can start somewhere. Like I said, I don't know what's in the content of the bill. Sure, on the surface, it's great. But the reality is there isn't just a bunch of social workers sitting around wondering if they can get a job, right? So there's a workforce issue that could be there as well. So I think that would be one component of addressing the sort of the need to have a kind of a culture and climate shift in schools.
I agree a lot. Thank you so much.
Yep.
Another follow-up question that I would add is, how could other laws or policy be changed to improve mental health and mental health education?
Oh gosh, this is a big one. So let me keep it relatively short. I think we have a long way to go in terms of access to care, either through insurance, whether insurance is great, whether it's crappy or you don't have it. I think there needs to be, we have a healthcare issue, right? I think in terms of, again, I mentioned the zip code of your school, but it also depends on what kind of insurance card you're carrying around, what kind of care you get, and what that looks like. And so I think there's a lot of room for improvement to sort of to make mental health treatment equitable. Keep using that term a lot because I think it's important. It's not just about access to care. It's saying, where do we need more care? Where do we need to improve services? In terms of schools specifically, one of the things that we work on at Mahaney's are sort of legislative briefings, and we have about anywhere from 20 to 30 different topics sort of floating around that we work on. And we were instrumental in 2016 in getting the mental health education law passed that required the K through 12 mental health instruction in the schools. And again, with a lot of laws, could it have gone further? Of course, but it was the first and right step. I think one of the things that we could see that could be a very big benefit to help students in New York around mental health is having specific mental health professional development requirements for teachers and for staff members. So not just saying you have to have 30 CTLEs a year, but 5 of them need to be in this subject area, or 6 of them, or whatever that number is, but really saying, we want you to, that part of your continuing education needs to be, a portion of this has to be around mental health instruction and mental health topics. So that's where I would go with that.
Thank you so much for that. And I know we're running a little over time, but I just need to ask you this one question because it kind of hits on the topic of our project. And it would be, what do people need to know to help address the mental health crisis overall? In your opinion?
Yeah, that's a big one. These are big questions. I love it. So I think what people need to address, I think what I would say is I would go back to that sort of lower level kind of person to person interaction. I think that Sage's question spoke to around the community is, I think in this moment, it's fair to say that every human being is having a difficult time trying to figure out what the heck just went on in the last 3 years, right? And I don't care if you're like, hey, this is great, I love remote learning, it's wonderful, but we've had an experience, a collective experience, where we're kind of left wondering, why do I feel this way? Why do I not feel this way? Why am I so angry, or why am I so sad, or why am I sort of just kind of so exhausted? I think part of it is normalizing it. And I think part of it, thanks, Sage. I think part of it is understanding that we are all, we're not, everyone says, we're all in the same boat. We're not in the same boat, though. We're all in the same ocean. And if you've heard that kind of phrase before, we're all in the same ocean, we're all in different boats. The acknowledgement that we're all surrounded by water would be really important, right? And so I think part of it is showing some courage to say, hey, this is, you know, where can I be vulnerable? Where can I express myself in a way that is safe and going to be respected? If I see somebody who's struggling, or if I'm somebody that I'm really worried about, can I take the risk of actually doing something to sort of try and get them the help that they might need, or reach out to someone that might be able to do that for them or connect them. But in terms of like addressing this crisis, I think what you're doing right now is saying this is important. We want to talk about this. And I think it starts with those one-on-one conversations. And I think it's about raising awareness. I think it's about the language that we use. And it's really kind of, I think it's about checking in with people, literally checking in with people, like, and saying, hey, I care about you. You know, like you're my, you know, and you know, how are you doing? And I really mean that, right? So it's about sort of those one-on-one connections, because that's where mental health, when people struggle with mental health, it's that they feel that they're alone and they can't talk about it. And that's where those problems then become bigger and bigger and bigger, right? Whether they become behavioral problems, whether they become suicidal ideation problems, whether they become substance abuse problems, it's because the thing that I'm experiencing is so overwhelming, but it's so isolating. And so if we can sort of help people feel less isolated in some ways, I think we can begin to move the needle a little bit, right? Maybe drain some of the water out of the ocean. We don't want to do that, but you know what I mean? My analogy is not going to work on that one, but that's what I would say is like, it's those one-on-ones, those one-on-ones, the kind of the steps that you can make on the daily basis. Sure.
Thank you so much.
There was a question from Christine. I'm fine. I had this till I had us till 8:15, but that's what I'm fine. If
Hi.
Oh, hi.
So my question was, what's something that you would do to increase the numbers of people having a stronger mental health? And I would like to specify it on like kids in schools and not like kids in lower income. Like for me, I know I go to Uncommon Charter High School, and we have social workers in my school, and it's kind of packed almost every day because a lot of kids go in there talking to social workers. But I want to know your ideas because we are starting clubs and stuff in school, and I kind of want to start something like to do after school. So I want to hear your input.
No, I think that your idea is spot on. I probably would kind of go in that direction myself. I mean, one of the things that I think that, you know, having been in school myself, right, is that some of the best things that in some of my friendships and things, as I said before, I was involved in music. So I was involved in drama for a while. I was involved in choir and band. Like those were things that really were important to me. And whether that's, you know, football, soccer, whether that's debate club, whatever that thing is, right? Those are things that happen outside the classroom. And I think the more that we can in this moment create spaces for students to regain some of those lost connections. I mean, you can't really, I'm sorry. I mean, Zoom is great, right? But you can't, it's not the same as being with your friends, right? It's not the same. And we've all lost something. And I think in high school specifically, I mean, there's people, they've lost a significant portion of what's supposed to be a really great time in their life, where they're making really great friendships and they're creating some wonderful lifelong memories. I am really still amazing good friends with my high school, my best friend in high school. Like he lives in Brooklyn, I live in the Hudson Valley. And like my best friends in life did not come from college, they came from high school. So what I would say is that where we can create opportunities for students to have a voice at the table. You know, you mentioned whether that be an advisory councils that actually mean something, not just sort of token student participation, but like actually getting student perspective, helping them sort of advisement around policy or procedures. But you mentioned something about the social workers being totally packed. And that goes back to my earlier comment, is that it doesn't need to just be the social workers that you go to and talk to, right? So can we take, and I've said this to teachers and I'll say it here, can we just pull back a little bit? Like, no one knows what's happening with Regents exam. They keep getting postponed. Great, wonderful. We don't know what's happening with them. But can we just pull back a little bit and sort of focus less on academic losses and more on increasing just the fact that we are human beings and we need that connection and time together? You'll figure out how to do your applications to college. You will figure out how to pass. And my thinking is, and this is me speaking, if we are not being aware, responsible, if we're not being in tune to kind of like the academic standards based on this point in time, I think we're really being tone deaf to what's going on. And so is this, I think this is an opportunity for us to maybe revise, right? Like, I've said this, I'll say it here. Maybe don't quote me, I don't know. I mean, I had curves, and when I was at teachers college, I was in a class and I was like, how did I pass this class when every test I got was like a 60%? I was like, well, because everyone was doing poorly. So then, yay, I got a B plus, right? Like, if we could do that in college, can we sort of look at it in high school and say, look, this is what we need to do right now? And so I think pulling back from sort of like the idea that school is a place to learn, but it's also a place to connect and to grow, right? And so my suggestion is, I think, to do what you're doing, those groups, those clubs, like creating sort of opportunities to say, hey, we want to hear like how things are impacting you. We want to talk, we want to create a space where students can come and talk about what's going on in the news, what's going on, what they're seeing in social media. Like, what are they seeing like that is impacting them? Because you walk around, you're not impervious to what's going on in the world. You know that what happens in your community, in the on TV, what you're seeing in politics, what you're seeing in sort of science, climate stuff, that impacts you. Have a space to talk about it. Let's not pretend that it doesn't impact you. So that would be a suggestion. Some suggestions.
Thank you so
Thank you.
much, Brandon, for your advice and everything you said. I think one great point that, well, overall, a message that I got from you today and which I want to incorporate into our project is closure. Like, I want our project to be something where it's not only just talking about the negatives, like you said, but also a space where people can contact any of us and have that kind of trust they would have with their parents or a closer friend, so that they could freely talk about what they struggle with and stuff like that. So thank you so much. We really appreciate it.
Absolutely. No, it's great. I appreciate you reaching out. I'm glad this worked out. So just let me know when whatever the fitness project looks like. I'd be happy to see how this process ends up for you all.
Yeah, I'll totally keep in contact with you. And thank you so much. We really appreciate it.
All right. Thank you, everyone. Have a good rest of the week. Enjoy your
You too.
year.
Have a
Thank
good
you.
night.
Thank you.
Okay,
Good
take care.
night.
Good night. See ya.